Hi, it's episode 25. And last week we were speaking about, well, I tried to teach you how to be a doctor in 30 minutes. I think I did a very good job. And this week I am going to develop your doctoring skills a little bit. We're gonna go back down, up. We're gonna move up a step. Can't think of the word now. From basic doctoring to like advanced level doctoring. GP doctoring, if you will, general practice family. Now this isn't stuff you get taught in medical school. This is stuff you get taught once you've graduated and you've done a few years on the wards and stuff, and you're a seasoned professional. So I hope you're ready. Hope you're ready to get stuck in. I shall make doctors out of all of you by the end of today. I'm going to talk to you mainly about communication skills and how we try to elevate our communication, our levels of communication, and clinical skills in the consultation. And the first thing we're taught is that we must build rapport. And I thought rapport was a word that people just used all the time, but I've not actually heard people use that word outside of the medical field. I mean, I think it is a word in the English language, and I'm sure you could look it up and you'd understand what it means. But building rapport, building a relationship with a patient is really important. And that's really difficult nowadays when you tend not to see the same doctor every time. I don't know if that's, depends on where you are in the world, and maybe you're lucky and you do see the same doctor every time, which I guess is lucky unless that doctor happens to be an arsehole, in which case, bad luck to you. But oftentimes you're not seeing the same doctor, or you're sent to a specialist or whatever, and you have to see a new doctor all over again, new face, new name. So, and let's be honest, even if I do know you, sometimes I need a bit of a reminder, which is thank God for notes. I can be like, oh yes, that's right, that's what we talked about last time. But building a rapport is really important because there's supposed to be a level of trust, right? When people are unable to trust their doctors, lots of things happen. The first thing that happens is that they are not able to be open and honest in the consultation. So sometimes they flat out lie. And I flat out lie to my doctor sometimes, especially when it comes to do with my diet. Do you ever, you don't eat sweets or cakes, do you? You're diabetic. Of course not, doctor. Of course not. No, I would never do that. Let's hope they don't follow me on social media. And then oftentimes it's much more serious things than that. And, again, we always used to get taught things like drug use and alcohol use. These are the things that people don't want to tell us. And sure, that's part of it. But it's also the little things. We know how easy it is to, either omit the truth or bend the truth or flat out not tell the truth in order to survive the medical consultation. A lot of us, we're just trying to survive it. We're trying to get out as unscathed as possible. We know we're going to get scathed a little bit, but we're trying to limit that. So we often tell our doctors what we think they want to hear, as opposed to what is the actual truth. And that's really problematic. How can we, as I said in the last episode, how can we possibly make a diagnosis without all the facts? And, part of the problem is we're not getting all the facts. We're not trying to get all the facts. But the other part is our patients need to trust us in order to give us the facts. And, we're already beginning to realise why this is a problem. And then beyond sort of being open and honest, another important part of trust is if you don't trust someone, you can't communicate with them effectively. That's just obvious, isn't it? If you don't trust someone, then it's really hard to hold a conversation. And that's what we're trying to do, hold a conversation. Another problem with trust is if you don't trust someone, why would you follow their advice? Seems pretty obvious, but that's why building a rapport with patients is really important, because once we get to the end part where we're going to offer them treatment and advice, we want them to be like, cool, yeah, no, of course I'm going to do what you say, as opposed to psh, I'm not doing that. And this is very relevant when it comes to things like following up, because I might say to you, if it doesn't get any better, I need you to come back and see me. And that is my way of saying, look, I think I know what's wrong, but I could be wrong. And if so, you must come back and see me. And if my patients don't trust me, they might not come back and see me. And then it might turn out that they had some weird and wonderful condition, or they end up getting sepsis or something. And I missed it. And that's because I didn't work hard enough to gain their trust. And so they didn't follow up with me. And finally, if your patients don't trust you, then they will avoid you. And I think many people listening to this podcast will be able to relate to that. We just avoid doctors because we don't trust them. So building a rapport is really important. Really important. It's about establishing trust. It's about establishing a bond. It's making somebody feel comfortable. It's bringing the adrenaline levels down, folks. When a patient comes into my office, I know that there's all this noradrenaline pumping around their body, all this adrenaline. Ooh, they're all like, they're in fight-flight mode. And I teach this actually in Take Your Power Back. It's not just fight-flight mode. It's fight, flight, freeze, flop, fawn. And so that's how people tend to react when they come into to see me. They're either ready for a fight or they're ready to run away, and they'll do whatever it takes to get out there quickly, or they freeze and, they just can't advocate for themselves, or they just give up, they flop, and they're like, fuck, it's not gonna, what's the point, why am I even here? Or they fawn, and this is the kind of like, I'm trying to tell the doctor what he wants to hear type of thing. So yeah, I don't want that. I want to bring those noradrenaline levels and those adrenaline levels down. So I want to like, hi, how's it going, how's your weekend, that kind of thing. Smile. And a lot of rapport is about non-verbal communication. We spend a long time learning about the different forms of communication, especially non-verbal communication, which fascinates me because I'm assuming everyone does the same training as me. Like, I don't think I got special training. Why is it? I mean, clearly no one was paying attention in that lesson because the doctors don't make any effort to be nice and put you at ease. Some of them do. That's not true. Some of them do. I'm thinking of a few. My kids generally, like pediatricians, most of them were pretty good, I have to say. Like, they obviously cared. Obstetricians were the worst in my experience. Oh my gosh. Why? Sometimes I look at doctors, I'm like, why are you in this job? Like, surely you should have a basic, like, desire to be kind and to serve people, to be in this job. Like, why are you here? What's with the face? But yeah, rapport. Something that we are taught is very important, and yet often goes ignored. Another thing that we are taught that we have to establish, ideally in the first couple of minutes of the consultation. So it's quite important, folks. You ready? It's an acronym. We love our acronyms in medicine. I think a lot of people in like important professions, so-called important professions, love an acronym. It just makes us sound more official. And this acronym is ICE. And it stands for Ideas, Concerns, and Expectations. And if you happen to have studied medicine, especially general practice, and are listening to this today, you will probably cringe as I say that, because you will have heard this a million times. Ideas, concerns, and expectations. What does that mean? I don't actually know. I mean, I do know what it means, but I'm not sure it's particularly helpful. Ideas is kind of... What are your ideas? What are your beliefs? What do you think is going on? Concerns are, what are you worried is going on? And expectations are, what do you want to happen next? That's actually, if you think about it, if you break it down, this is very important. What you think is going on is very important. I will often say to clients, one of the problems is that everybody has been told to outsource their intuition, their own health beliefs, their own kind of relationship with their own body to other people. You got issues with your physical health, you go to a doctor. You got issues with emotional health, you go to a therapist. You have issues, you know what I mean? Like, you go see someone, and there's nothing wrong with that. Of course, I'm all for going to see someone, but what we sometimes get into the habit of doing, and it kind of depends on the professional how they handle this, is that we just give them control. We're like, okay, well, you tell me what to do, and we outsource that kind of responsibility. So rather than a doctor who's saying, all right, well, what do you think's going on? What's your body telling you? Let's listen to your body for a moment. And they're like, well, this is what is going on, not what I think. This is what is going on. It's not even what I think, which is much more true and honest, because we don't know, we just think. It's more like, this is what's going on, and this is how we treat it, and that's the end of that. So getting in touch with your with your body is really difficult, because you've been outsourcing it to other people for a really long time. I think it's really important to address concerns. Like, I think that's so... I didn't get this to begin with, and then I did when I had my own children. I remember when I used to work in pediatrics, like meeting all these parents who were like really concerned about things. And sometimes like they had every right to be concerned. And sometimes I'm like, why are you so worried about this? Like, why are you here? Like, this is minor. What's stressing you out? And then I had my own children. And then I realized one of my primary concerns, especially when I had babies, was that they were just going to die. I was worried deep down inside that my children might die. There was points in time, now to be fair, I did have postnatal depression, but even beyond that, you know, there were times when I'd just have to go and check that they were breathing. Or I've always worried that does this mean they're going to die? Does this mean they're going to die, or they're going to get really sick? So I catastrophized. And even as a sensible parent who was also a doctor and has also done pediatrics, I still had moments where I worried my children were going to die. And so once I had children and parents would bring in their children, I would just ask the question, what are you worried about? It's such a simple question. What are you worried about? And it was almost always something very sensible. Like, I'm worried about meningitis. I'm worried about... There was always something. I'm worried it's leukemia. I'd be like, oh, okay, yeah, no, I understand. And then I would validate that straight away. Of course, I understand why you're worried about that. And then I'd usually say something along the lines of, but I'm not worried about that. And here's why. And then I would explain why I didn't think it was meningitis. And I would show them, the framework that I use. I would explain, I've checked your child's OBS, I've done the pulse and the respiratory rate and the oxygen saturations and these are all within normal ranges, and I would explain everything. And they'd go, okay, thanks. And then they'd be really relaxed. And I realised before I wasn't doing that, and the parent was never fully reassured, and I could tell something's missing here. Like, I'm sitting here going, well, it's nothing, it's just a simple viral infection. The parents look at me like, But because they were worried that their child was going to be really sick, and it was totally understandable. So concerns are really important. What are you worried about? When you have a headache, chances are you're worried about a brain tumour. Even if you don't think it's a brain tumour, even if you can say logically, I don't think this is a brain tumour, I'm willing to bet that it's crossed your mind and you're worried about it. So these are really important things. What are your concerns? And then what are your expectations? I know why doctors don't want to know this, because they don't want to meet your expectations. And some of it is because, look, I often criticise doctors. I do. I think there are things that we aren't getting right. I think there are things that we are getting wrong. And I think there are some doctors out there that are dangerous and need to have their medical licenses stripped. However, I will also acknowledge that a lot of this has to do with limited time and limited resources. That's not to say we have it hard, because we don't. We make good money. But the limited time is a thing. So if I've only got 10 minutes and you have a lot of expectations, chances are I won't be able to meet them all. So it's easy for doctors to avoid it. The problem with that is that then we don't meet your expectations. And so you'll either come back or you'll leave really disappointed, or you'll avoid us in the future. Another way of doing that is just to say, right, let's figure out what your expectations are. And then when I'm like, I can't do that in 10 minutes. I'll explain. I can't do that in 10 minutes. But here's what we're going to do. So it's easy then to say, okay, I know what your expectations are. I know I'm not going to be able to meet them all, but this is how much we'll be able to get done today. And then we'll make a plan for what to do later. So yeah, ice, baby. The other thing that we're taught is really important is paternalistic medicine is a thing of the past. And I'm sure I've mentioned paternalism in my podcast before. I don't know how much of this stuff I'm repeating. You may all come back to me and be like, Asha, you've already covered this. In which case, this is a refresher. Consider this a refresher. Those of you who are joining me and haven't heard already, then this is all new to you. How exciting. But anyway, paternalism, terrible stuff. Terrible stuff. It's what we did for centuries. Doctor knows best. And we get to decide what you need. You don't get to decide your expectations. We do. We decide for you. We know what you need. And we're not supposed to do that anymore. I don't know if you know that, but that just kind of that went out. That kind of type of form of medicine went out a long time ago, before I started. And so, it's quite some time now, paternalism should be a thing of the past, which is hilarious because medicine is becoming more and more paternalistic every single day. Like, doctors just, like, we're gods. We get to decide everything now. Like, we have so much control and we don't care what you want. Come on. Then alongside paternalism is individualised care. I don't know if you know this, but we're all special little snowflakes. We're all different. We are. We're all different. And so what works for one isn't going to work for the other. And everybody has individual ideas, concerns and expectations. Your risks will all be different depending on who you are. Did you know that? And so if you have one blanket rule for everybody, it's not going to work for anybody. Therefore, you should practice individualised care. How do you practice individualised care? Well, first of all, you have to develop a rapport with your patients and you have to get to know them. Then you have to get all the facts, including their ideas, their concerns and expectations. You have to realise that you don't know best and you are not God. And then you have to start making decisions with your patient. Listen up. They have the right to autonomy over their own bodies. If you are learning to be a doctor right now, if you're enjoying this Learning to be a Doctor podcast, pay attention. Patients get to decide what happens to their own bodies. And you have to make it possible for them to actually make those decisions and then enact them. There's no good at saying you have control over your own body. You get to decide, but whatever you decide, this is what's going to happen anyway. Like, you see what I mean? That's individualised care. So say, for example, okay, patient comes to see you, and you take, we've just done liver function, right? We've just done fatty liver disease. If you missed the fatty liver disease masterclass and now like, oh no, I missed it. It's all right. You can catch it on replay. Yeah, you can catch all of them on replay. But we'll go with fatty liver. Someone comes in and they've got abnormal blood results and you've seen a scan. They've got a fatty liver. Oh, fatty liver. You must tell them about it because you should never, ever miss an opportunity to fat shame a liver, folks. I mean, so much fun. That was sarcasm. For those who didn't get that, was me being sarcastic. You don't actually need to shame people's livers. It's not necessary. And then basically they come in with you've got their results and you look at them and you say to them, you've got, hepatic steatosis, and then believe it or not, they actually want to know some information. And so, it might be useful to ask them what their ideas and concerns and expectations are. But let's say we get to the end of that and then it's like, okay, well, one option is to lose some weight. And the patient says, I'm going to stop you there. I don't do weight loss. That's not for me, thanks. Now, this is the point in time where individualised care becomes relevant. Because if a patient says, I don't do that, or I don't want that, or that's not for me, or can we stop talking about that, or any of these things, that's consent. So if they don't want to do it, then they don't do it. That's individualised care. And then what you have to do next is go, all right, well, we'll put that to one side since you're not doing that. And instead we can do this. See how that works? See, it's very simple. I don't know why people find this so difficult. So how to be a good doctor? Let's put everything together. The first thing we need to do is understand the problem. Because generally people don't come see a doctor unless there's a problem. You don't come in for a chat. You're not there for tea and cake. Oh, that would be so nice if you were there for tea and cake, especially if you brought the cake. But no, you come to see a doctor because there's a problem. So it stands to reason that the first thing a doctor needs to do is understand the problem. And when you're understanding the problem, you need the whole picture. And last week I was talking about that framework. I was talking about relationships with yourself. So physical, emotional, mental, joy, pleasure, stuff like that. Sexual. And then relationship with others. So family, intimate relationships, friendships, community, money, and then relationship with the world around you. So this would be your environment, your physical environment, but also other things that are happening in the world that may or may not be impacting you. And the big one, discrimination and stigma. So we need to understand the whole problem, not just part of the problem. And then the next thing we do is we identify needs. And this is what I tend to do with my clients. I will sit down with them and I'll say, okay, what do you need to feel, and I might say healthy or well, or in some cases I might say safe, because for me, safety is an integral part of health. And a question I will often ask clients is, do you feel safe right now? And have you ever felt safe? And you might want to pause this for a moment and think about that yourself. Do you feel safe right now, or have you ever felt safe? I genuinely believe it is impossible to be healthy or to feel well if you don't feel safe. And so that's why I don't like to use the word healthy, because I prefer well. Do you feel well? If you don't feel safe, is it possible to feel well? Probably not. For those of you who know about Ayurvedic medicine or who are interested in the chakras, we know that the root chakra is the first chakra. It's all about safety and security, which makes sense. Stability. The root, the base, the bottom, it's right at the bottom of your tailbone. That's where the energy center is. When we're practicing Reiki or certain forms of medicine or healing that involve that use the chakras or as a frame of reference, like you start at the root. You don't start anywhere else. You start at the root. The root's the important part. If the root's not okay, then it's going to be really hard to go up. There's no point focusing on the crown, third eye, if the root's not balanced. So the same goes, I believe, for any sort of framework when we're looking at health. If you're not safe, if you're not stable, then probably you're not well, or it's difficult to be well. Let's put it that way. So, I lost my train of thought there. So what do you need to feel well or healthy? And I just ask the question, and we do like a spider diagram. I'm like, let's list them all. And it's different for everybody. So here are mine. I'm trying to remember all of mine now. So safety and security is one of them. Positive body image is definitely one of them. Having energy, not being in pain, and I should really know the rest of them. I really should know the rest of them. I've got to look them up now. I have like a little list, and sometimes I show people mine, and I'm like, oh, where's mine? Come on. Oh, sorry about this, folks. This is, it's not good that I don't remember myself. Here we go. I was trying to think, where can I share this? Okay, so positive body image. I put healthy relationships, really important. For a very long time, I wasn't very good when it came to boundaries. I watched this really good video on, I think it was Insta or TikTok. Well, it would have been Insta because I don't have TikTok anymore. And there was this wonderful woman who I didn't pay attention to who it was. And then you know how sometimes Instagram refreshes your feed and then it's gone and then you can't find them again? Very disappointing. So I can't give them credit, and I'm really sorry. But if you've watched the video, then you can give them credit and let me know, and then I can credit them. So there's this beautiful woman, she's just getting ready for work, and she's talking about relationships. And she uses the words associates, acquaintances, associates, and then proper friends. And I really like that way of thinking of people, that you have your acquaintances are just people and then you have your associates who are people that you probably spend a lot of time with. They might be people you work with, etc., and then you have your friends, and then they're different. And I used to invest a lot of my energy into my acquaintances and to my associates. I spent a lot of time trying to get them to like me and to meet their needs. And a lot of that has to do with the fact that I grew up a child of a narcissist. And also that, I'm fat, and so I'm trying to get on with people, and there's I'm sure a lot of you can relate to this to some extent. And then as I sort of began to recognize my self-worth, and I began to put up boundaries and be like, actually, I'm not investing in these people. Like, I'm only going to invest my energy into these people. I got much healthier. So healthy relationships, no pain, I said, energy, I said, freedom from oppression. Those of you paying attention to my social media will know that I had a bit of a wobble towards the end of Pride Month. I really don't like Pride Month. I know we're all supposed to love Pride Month. I don't. As a trans person, I do not like Pride Month. I think it's a lot of lip service. I'm fed up of seeing fucking pride flags everywhere because you only fly them once a year, for 1 month. And the level of hate that I experience always goes up during Pride Month. Hate it. So as a trans person, as a fat person, as a queer person, as a neurodivergent person, I would love not to experience oppression all the time. That would make me feel much better. Joy and pleasure got in there. For me, that's food. That's really important, being able to eat and enjoy my food. So that's in there, but it's not the only thing that gives me joy and pleasure. Support from other people. I'm not good at asking for it, so that's really important. Good self-esteem came up there as well. And then safety and security. So these are all things that for me would help me to feel well. And a doctor might look at that and go, yeah, that's not my job. I don't care about any of those things. I'm here to give you medicine. And to a degree that's fair enough. But also, and at the same time, if those things are not, are not good, if I'm not feeling well, then chances are I'm coming back. And oftentimes, because as I said, we are so tunnel visioned when it comes to physical health. Oftentimes there's problem going on with the other stuff. And it either manifests physically, which is very common. So you can get physical symptoms as a result of other underlying issues. Or we're like looking for answers, and so we look to physical health because that's where people are giving answers. No one's going, do you know what you really need? You need some healthy relationships and some joy and pleasure in your life, and you need good self-esteem. Maybe a therapist might, a good therapist. You probably have to pay for one of those, and so most people can't access that. And so it's not my job as a doctor, but also a good doctor at least understands this. And at least has the ability to go, okay, this makes sense. You're not feeling safe. So, of course, you've got lots of adrenaline and lots of kind of chronic stress hormones floating around in your body. Like, the chronic stress response has been activated maybe for months, maybe for years. And so that's going to impact you physically. And that might actually impact the numbers on your blood test. That might explain why you're a bit insulin resistant at the moment, why your cholesterol's gone up, why your liver function isn't 100%. Not because of anything else, but because of this and this and this that's happening. That makes sense. Maybe we should leave it for 6 months because, all of these things are going to die down, or maybe we should work on the other things and then, or at least explore the other things, all of that stuff. You see, we're so quick to go fatty liver, cholesterol, diabetes, metabolic syndrome, pre-diabetes, and all these other things, instead of going, I wonder if my patient feels safe right now. Just going to leave that there. So if you come to see me, first I understand the problem. This takes around about an hour to 90 minutes just to understand the problem because I'm interested in everything. Then we identify your needs. We do a little spider diagram. What do you need to feel well? Then we discuss your concerns, and not just your concerns about what could be going on, which is of course very important, what you're worried about, but also your concerns about the journey. What happens next? What are you worried about? And that includes things like, I'm worried you're going to miss something. I'm worried that there might be something underlying going on. I'm worried that I'm going to be dismissed again. I'm worried that I'm going to have another weight loss lecture. I'm worried about this. I'm worried about that. So it's about understanding what all your concerns are, not just the ones about the physical symptoms. And then finally, we together set some goals. Like, what do you want to happen? So we talk about needs, and then we talk about wants, and wants and needs often link to each other, but what you don't, not everything that you want is something that you need. But I encourage people to want, like, not just this is what you need, what do you want? So, and some people don't actually they're not looking for necessarily treatment. They're just looking to understand. I just want to understand what's going on. That's a huge thing. I want to understand. For some people, one of the goals is help you to trust your own intuition more, and then to advocate for yourself when a doctor is kind of pushing back against it. So for you to feel confident to say, no, this is what's wrong. Figure it out. Prove me wrong, as opposed to, or whatever you say, doctor. For some people, it's very practical. For some people, it's much more kind of, here are the areas that we need to work on. But yeah, that's great medicine, I think, I hope. That's what my clients tell me. I think that's it. Do you know, I'm starting to shut up at 30 minutes each time. That's very good, isn't it? I'm getting better at this. I think 30 minutes of my voice is enough for you. I think you shouldn't have to endure any more of that. So I'm going to leave it at that. Don't know what I'm going to do next week. Haven't thought that far ahead, but I hope you enjoy this series. I hope you're all going to be amazing doctors. And, truth is, you probably need to be, because it's not like your doctors are going to be good doctors. So we have to become our own doctors, which is really difficult. Speaking of that, got an announcement coming up soon. You don't want to miss out. In the meantime, you know where to find me, fatdoctor.co.uk. You can find all the old masterclasses on there, that website. Just go to fatdoctor.co.uk /events. Then you can also book an appointment with me. You can work with me face to face. If you have a desire to learn about something in particular and you're like, oh, I wish Asha did this, you can just email me, right, and be like, can you do this? Because chances are I'll be like, oh, that's a great idea. I don't like coming up with ideas all the time. I'd rather do something that you want rather than me thinking what I think you want. Does that make sense? So just actually talk to me, let me know. If you're not signed up to my emails, I write an email a day on average, no more than one. Relax, but not always one, but most of the time, weekdays, not weekends. I have weekends off, and I write emails, and most of the time they're kind of like a little mini blog, really, like a little, I try and give you some information, because one of my biggest desires is to provide as many resources as possible for people. So if you like reading stuff, then sign up to my emails. If you're the kind of person that's just like, I don't read my emails, I'm one of those people, then don't sign up. But if you do, then definitely sign up. Get onto my mailing list, and then you can just reply directly to an email. Every time you have a thought, just reply. It's great. I love it when people talk to me. I wish more people talk to me. You know that you can follow me on my social media, and you can talk to me there, although that's much harder, to be fair, because in order to keep the trolls out, I have quite high kind of measures to stop people from getting in, as it were. So better not to try and DM me on social media, better to try and contact me through my website. All right, that's enough. Hope you enjoyed today's episode. I'll see you again next week. Maybe, no, I'm not saying anything, not maybe nothing. It's just leaving you in suspense. No promises. See you next week.